Okay, welcome everyone, and thank you very much for joining us today. This is the third in our series of webinars this week discussing the specific campaign opportunities that we're offering as part of this CSPI subgrant funding round. So today we're going to be talking about restaurant kids meals. And just to go over a few logistics before we jump into the content of the webinar, it'd be great. We have a lot of folks on the call. If you don't mind dropping your name and organization and maybe the state or city where your organization is located into the chat so we have an idea of who all's here, that would be great. Please keep your microphones on mute during our presentation, which will be pretty short. I'm going to give an overview of the grant opportunity, and then my colleague Sarah is going to take over. She's the team lead for our Restaurant Kids Meals campaign, and we'll talk through the specific opportunity. And then we'll have plenty of time for Q&A. And we ask if you just think of questions along the way, you can go ahead and type them at any time in the chat, and when we get to the chat, the Q&A portion of the webinar, my colleague Katie will help facilitate that chat, and we'll essentially just run through questions primarily in order that they were asked. So just to give a brief overview, I know we may have people and organizations that have a varying degree of familiarity with CSPI and our work. So CSPI is a consumer advocacy organization that's been the leading independent authority on nutrition issues since 1971. We work through advocacy, policy, education, and litigation, working to make it easier for all Americans to eat healthfully. Just to highlight a few of the efforts that we've led in the past, we were leaders in passing laws to secure the original nutrition facts labels on packaged foods in the 90s, adding trans fat to labels, added sugars and major allergens, menu labeling in chain restaurants, supermarkets, and theaters nationwide, getting soda and junk food out of schools and improving nutrition of school meals, and reducing junk food marketing to kids. Let me just... And so the background on this specific opportunity, CSPI has been awarded a grant from Bloomberg Philanthropies to lead a national advocacy initiative with a focus on securing state and local food and nutrition policies that improve public health and particularly provide models that can be scaled and replicated. As part of this initiative, we're seeking applications from state and local advocates to help advance innovative policies in a variety of areas, including restaurant kids meals, which is the focus of today's presentation. And we are particularly focused on supporting public health for all and addressing health inequities that unjustly affect low-income families and communities of color. So as I mentioned a few times already, this is the focus of today's webinar is on restaurant kids meals. We also have opportunities related to SNAP, school meals, and menu disclosures on restaurant menus. And we've had 2 of the 3 other webinars already. We have a webinar on school meals tomorrow, and all of these are recorded and will be available on our website if you want to listen to them yourselves or point others in the direction of the webinars. So at this point, I will hand off to my colleague Sarah to walk through the rest of the presentation.
Thank you, and hi everyone. There's a lot of familiar names and faces and some new ones, so I'm excited to see you all. So I'm going to walk briefly through a little bit of background, perhaps sharing information that many of you already know or operate under kind of the same facts, but I just wanted to kind of set a baseline to get started. And so on kind of why restaurants and why we're working on restaurant kids meals. First and foremost, kids meals are marketing and restaurants are top food marketers to kids. And the restaurant kids meals play a large role in shaping children's preferences, what is considered normal and appropriate kid food, and really shape lifelong eating habits. So it's really important to address from a young age, including through restaurants and the marketing that they do. Additionally, children get approximately 25% of their calories from restaurants, and eating out by children is associated with higher consumption of calories, soda, and other sugary drinks, saturated fat, and total sugars, and also associated with lower consumption of things like fruits and vegetables. Next slide. So I'm going to come back to this, but I wanted to very briefly kind of address the two kind of larger buckets of kids meal policies that we're going to be talking about, and that we're seeing kind of within the momentum for these policies already. And the first is for defaults for restaurant kids meals. And so these are the beverages and or the sides, which are the automatic option that come with a kids meal, which is a beverage side and an entree bundled together. And these will be what's listed on the menu or menu board in a restaurant. And for the great majority of policies that have passed, this does not mean that restaurants can't have, for example, soda that is available with the kids meal. It's just not the default option. So we're talking about what people might see and might kind of help to shape norms, but not saying altogether that restaurants can't offer this if it's requested by a family. And then the other large bucket here is nutrition standards for a full kids meal. So those are the standards that would apply to that combination of a beverage side and an entree. And like I said, I'll come back to more specific details on this in a minute. Next slide. So I also wanted to talk a little bit about the research that's out there to support these policies. The two at the top here, the Disney and McDonald's research, is a really good example of the research that's been done to date related to voluntary policies by restaurants or other entities that are serving meals in some capacity, and really highlight the impact that defaults in particular can have on the choices that families make. So at Walt Disney theme parks, meals with healthy defaults had 21% fewer calories compared to children's meals with unhealthy defaults, and this was both beverages and sides. And additionally, parents stuck with healthy side dishes nearly half of the time and healthier beverages 2/3 of the time. And important to note here is that going to Walt Disney isn't necessarily something you associate with choosing the healthiest options. It's a treat, it's a vacation, things of that sort. So to know that when you put the healthy options as the default options, even in a place like Disney, that people are sticking with these sides and especially sticking with the beverages much more than they would be ordering them if they weren't the default is really significant. And then additionally, McDonald's, following their commitment in 2013, found that between 2013 to 2018, the share of Happy Meals served with milk, water, or juice, which were the options that they indicated as the healthy defaults, increased by 15 percentage points specifically in the US. And then finally, most recently, Healthy Eating Research released a brief on the implementation of kids' meal policies in California and Wilmington, Delaware. And what they found was that there's certainly a need for clearly establishing what is covered by the policy. So for example, are we talking about the menu or menu board, or are we talking about what cashiers or wait staff, for example, are covering? And so those are things that as we move into kind of determining the policies in any given state or locality, we'll want to be sure to be addressing together to make sure we're having the strongest bill possible. And I'll just also add here that there is more research coming up on the changes in consumption or at least buying patterns, but given the kind of it's not totally new, but the newer timeline for these policies, there's a lot of research that's underway that hasn't yet been released. So there's really more research to come, but I think we have really great foundational research based on what some of the companies like Disney and McDonald's have done. Next slide. So the exciting stuff is about the policies that have already passed. We have 3 states that have passed policies and nearly 20 localities. I'll mention that all of these are default beverage policies, except the 2 that you see that have kind of notes next to them. Louisville, Kentucky had a positive nutrition component requirement. And then most recently, just within the last few weeks, Prince George's County, Maryland, passed the most comprehensive kids meal bill to date. And that included over time in what they called a tiered approach or phased approach, healthy default sides followed by, beverages followed by healthy default sides. And then finally in the kind of last phase, moving into the 5th year, one healthy meal or a meal that would meet nutrition standards. So they kind of ticked all the boxes that we've been talking about, which I think really is great timing as we talk about this RFP and the opportunities for the future. Just having a more comprehensive bill that has made its way all the way through the process and will be moving kind of towards that implementation really allows us to look towards a success that's greater than the beverages, which we've seen a lot of success and look forward to a lot more success on as well. Next slide. So I'm going to wrap up by talking a little bit more in detail about the policies. I said I would come back to kind of the details. And this is included online, so no need to take vigorous notes or anything, but our goals at CSPI for people who are applying is to seek to secure a policy. And this wouldn't be anything that's voluntary or programmatic, but kind of formal legislative policy. The funding is for up to $75,000. And policies must meet the following standards. And so I'm going to walk through the 3 buckets of nutrition standards, sides, and beverages. And I'll note that it doesn't need to meet all of them, but for any given category, these are the standards. So if you choose nutrition standards, it would need to meet these requirements. Or on the next slide, I'll go through the beverages and the sides, which also have standards. So as you can see here, the nutrition standards for all restaurant kids meal combinations would require these meals to meet the standards that include limits on total calories, saturated fat, added sugars, sodium, and a requirement to have meals meet certain categories of foods, including fruit, vegetable, non or low fat dairy or whole grains. And so they would need to have at least two, or a requirement for at least 2 of those categories. Next slide. And so for default beverages and default sides, you can see here what the specifics are. On default beverages, the standards require defaults to be any of the combination of water, milk, or juice, with the limitations you can read next to each category. And with default sides, what we're talking about is a requirement that the sides be at least 1/4 cup of unfried fruit and or at least 1/4 cup of unfried vegetables, excluding white potatoes. So we're not talking about French fries, and making sure that we're keeping French fries out of the policy in terms of the default sides. Next slide. I think that's it for me, actually. Yeah.
Sure, I can jump back in. Thank you. So in addition to those specific priorities across our campaigns, we've laid out some high priority areas that would be favorable to see in applications that we're reviewing. We're very interested in applications that include a strong community engagement, field organizing, or grasstops engagement, incorporating a strong focus on equity throughout all aspects of the campaign, are from diverse organizations who are either representative of the population for which a policy is focused, or committed to directly partnering with individuals and community organizations representing that population. including a robust media and public communications plan, and identifying in the application your plan, thinking about what potential obstacles might be and how you would plan on mitigating those, such as industry pushback in the case of restaurant kids meals. And then identification, if possible, identification of policy champions within state and local government, so we can know that you're thinking ahead about how you might work to get this policy passed. And so we are really seeing these grant opportunities as opportunities to partner with organizations doing work on the ground. And we want to make ourselves available any way we can. So this is just a few examples of the type of resources that we plan on offering to grantees. We have worked on, for each of our campaigns, a lot of toolkit materials. We've done messaging research and communications materials and support. We might even be able to do our own sort of digital media and paid media to support the campaign, depending on the circumstances. We can provide technical assistance on policy and research, and support staff from our media team and our staff to provide testimony or op-eds and other articles. Also support, we have a whole organizing team at CSPI, so they would be happy to help where appropriate on the grassroots organizing, grass tops engagement, and coalition building. And finally, support with strategies around state and federal lobbying. So our next steps are, as Katie mentioned, we'll be recording this webinar, so you can feel free to refer back to it. And as Sarah said, there's a specific campaign priorities document for restaurant kids meals that's accessible via our RFP. So all the details should be online. We're asking for applications to be submitted through by the end of the year. And most likely our grants will be running in a one-year grant cycle, probably starting February 2021, running through the end of January 2022. We do realize that sometimes, policy life cycles in this work may take longer than one period. So we encourage applicants to be realistic of what, based on timing of, legislative sessions at city council meetings, like what could be accomplished within a one-year period, and where is your jurisdiction at in terms of being ready to pass one of these policies, and talk about what could be done throughout the year, and then what might be, your visions for longer term plans after the first year. And here is the contact information for myself and Sarah. You're welcome to reach out to me if you have specific questions about the Common Grant application, but their tech support that I've experienced has been really great. So you can also reach out to them if it's specific technical questions. So now we can open it up to questions that anyone has. I don't see anything in the chat yet, so feel free to type your comments, questions, or if you'd like to unmute and ask a question, we can try it that way and see if we can manage the Q&A that way.
Hey, Noel. This is Don Weissman in Hawaii.
So.
Hi. Well, are any grants available for implementation of policies once they're passed? Because getting them passed is only half the battle, as we're learning. And especially now with the states facing such huge budget deficits, I know our Department of Health is looking at least a 10% cut in budget and potential staff furloughs. So there, things they were starting to implement our law at the beginning of the year, and things have really bogged down, and they're going to be challenged going forward to come up with the resources to really do it right. And I'm just wondering if there's going to be resources made available to help states implement.
Mm-hmm. That's a really good point, I think. and something we should be considering. I don't know if Sarah, you have any comments on whether that's something we've considered at this point, or something maybe we need to discuss internally and circle back to you.
Yeah, I think I agree with you, Noel. We need to kind of talk about that and think about it. Donna, obviously there's a policy already in Hawaii. Is the question about the policy that's already passed, or for new policies where you might pass it and then need additional implementation kind of help and support?
This is for the policy that was passed in 2019 and took effect on January 1st of this year. And I'm working with our Department of Health on implementing it, but they are, they're going to be facing a lot of challenges for the next few years, financially at least, and even staff-wise, there may be cuts in staffing. So they may not be able to do it on their own. They were going to be the ones implementing it, but it may take additional community support, I think, to implement it properly. They still have to go through the rulemaking process as well to set up penalties and things for those who don't follow the law. But that's something that's begun, that process, but that takes time too. But I'm just concerned about how our Department of Health, how effective they're going to be moving forward in the near future because of the state's huge budget deficit and the cuts that they're facing.
Yeah, no, that makes a lot of sense, and we share your concerns. Let us circle up internally and get back to you, but I definitely hear you, and we'll be in touch.
Okay.
Yeah, important point for us to think about, that not just passing the policy is one thing, but the implementation is important as well, to ensure that it can be successful.
Hi, so I've received a question in the chat about whether or not we'd be offering this grant next year as well. And so if Noel, you could address that one for us.
Sure. We don't have certainty about our future funding opportunities. Our anticipation is this is part of a longer program. And so it's likely that we would be offering future funding opportunities. I think we'll be working over the next year on, reassessing our priorities under the grant and prioritizing. So things might look a little bit differently in terms of what we offer in the future, but we do anticipate future funding, and we also anticipate that if we are actively working with campaigns that are promising and going well and would just need some additional support to get over the finish line, that we would hopefully be able to continue to partner with those groups. Any other questions? You can ask procedural questions or specific questions about the policy work. Or we're happy to wrap up early, but we want to also just stress that you can feel free, if you don't have specific questions today, but they come up as you're working on your application, feel free to reach out to us. We're happy to field any questions and help put people in the position to have the best applications to submit.
Hi, this is Tessa Hale from Boulder County Public Health. And I had a question similar to Don's around, we're really close to passing this policy in Longmont, Colorado. And I think where we're needing support to sort of get it across the finish line, and I saw you had funding for this, is support for things like maybe reprinting menus or doing some education trainings for staff so that they're not offering sugary drinks once the policy is changed. So more implementation type support is also what would be really helpful to us, just to throw that out there.
Thank you. That's helpful to know. And as we said, we'll talk about that and determine what specifically we can get involved with. I think those are important areas to ensure get funded one way or another.
We did receive another question in the chat. So for the demographic focus, it says to describe the demographics of the target jurisdiction, which includes race or ethnicity, income, LGBTQIA, and disability data. So the question is, would we need to include all of these categories of data in the application?
It is, we were trying to be comprehensive there. I think it's not necessary to include demographics for every single category, but definitely I think the race and ethnicity background and other sort of characteristics, key characteristics of who, you know, the city or jurisdiction that you're working in should be included. Sarah, do you have anything else, any final comments to add before we wrap up?
No, nothing specific. Obviously, thanks to everyone for joining. Our goal and my goal with the RFP process is to be able to answer as many questions and provide as much support as people need going into the process. So the applications are kind of comprehensive and there's a lot of transparency. So definitely continue to reach out. As Noelle said, we're available. You have our contact information. I'm happy to get on a call or whatever's best.
And we do encourage applicants, organizations to work together. And, you know, we'd be happy to have, you know, sort of a proposed coalition coming to us. Our general advice on that is to have one organization designated as the lead who would be the applicant for the grant, and then be providing sub-grants to other organizations. But definitely, you know, we think that's great if there's various community-based organizations and folks working in maybe different parts of the state or just focused on different aspects of the campaign work. We're very open to that. Okay, so I will go ahead and wrap up. Thank you everyone for attending. Hopefully we were able to give you some more information on this opportunity, and feel free to reach out to us in the next few weeks, and hopefully we will see some of your applications later this month. Have a great
Bye-bye.
day.
Thank you.
Thank you.